Good afternoon, everyone. How are you guys doing today? The title of this presentation is Transforming Health in Portsmouth, Tackling Diabetes Through Equity and Prevention. If you guys did not know, my name is Kayla Cherry and I will be presenting today. Portsmouth is located in the Hampton Roads region of southeastern Virginia. It is an urbanized area with a population of about 97,000 with a mix of middle and lower income households. Despite its rich historic background, the city faces significant public health challenges. Portsmouth population is racially diverse. Most of the percentage is identifying as African American, followed by white and other minority groups. This diversity brings cultural richness, but also highlights racial and social economic disparities that deeply influence health outcomes. The community struggles with high rates of chronic diseases such as diabetes, hypertension, and heart disease. These issues are closely tied to social determinants of health. Environmental challenges also play a significant role. Given these factors, Portsmouth is a priority for public health interventions designed to address these systematic challenges and improve overall community health. Determinants of health. The health of Portsmouth residents is shaped by a variety of social, economic, and environmental determinants. Let's take a closer look at some of the most impactful factors. Economic factors. Portsmouth has a high poverty rate and unemployment rate compared to state averages. Many residents live paycheck to paycheck, which limits their ability to afford nutritious foods, healthcare insurance, and transportation to healthcare facilities. Education and employment. Education levels in Portsmouth are lower than in many neighboring communities. A lack of educational opportunities limits job prospects, leading to a cycle of poverty that impacts overall health. Food insecurity. Large parts of Portsmouth are classified as food deserts. They lack access to affordable and nutritious foods, which contributes to obesity and diabetes. Healthcare access. Many residents are uninsured or underinsured, making it difficult to afford routine checkups, screenings, or prescriptions. This city also suffers from a shortage of healthcare providers, particularly in primary and specialty services. Environmental factors. Poor air quality, limited recreational facilities, and unsafe neighborhoods contributes to high rates of respiratory and cardiovascular diseases. Together, these social determinants create a web of health disparities that disproportionately affect the most vulnerable populations in Portsmouth, particularly those living in low-income areas. Health issues affecting the community. Let's examine the key health challenges facing Portsmouth. Chronic diseases. Portsmouth has some of the highest rates of chronic diseases in Virginia, including diabetes, hypertension, and heart disease. Obesity. According to the data from the CDC, Portsmouth has alarmingly high rates of obesity. Limited access to safe recreational spaces and affordable health food options further worsens this problem. Smoking and respiratory issues. Portsmouth also has a higher smoking rate compared to state averages, which contributes to respiratory diseases like asthma and COPD. Mental health. Mental health is another growing concern with high rates of depression and anxiety reported among residents. This leaves these conditions untreated. These health issues are not isolated. Addressing these interconnected issues requires a comprehensive public health strategy. In-depth discussion of one health issue, diabetes. Among the chronic health issues in Portsmouth, diabetes stands out as one of the most pressing. The prevalence of diabetes in Portsmouth exceeds both state and national averages. Most cases are type 2 diabetes, which is strongly linked to modifiable risk factors like obesity and poor diet. Type 2 diabetes develops when the body becomes resistant to insulin or when the pancreas does not produce enough insulin. Over time, this leads to persistently high blood sugar levels, which can result in serious complications such as heart disease, kidney failure, and nerve damage. Despite the high prevalence of diabetes, many residents are either unaware of their condition or unable to manage it effectively due to the barriers of health insurance and limited access to primary care. addressing these diabetes through multifaceted approach, including community education, improving access to healthcare, and programs that promote healthy eating and physical activity. Levels of prevention and access to healthcare. To address diabetes and other chronic diseases effectively, we need a prevention strategy that targets all three levels of prevention. Primary prevention, the process of preventing diabetes before it occurs. For example, local schools and workplaces could offer programs to promote balanced diet and regular exercise. Secondary, this involves early detection and intervention to prevent the progression of diabetes. Partnering with community organizations to hold health fairs and screening events can improve access to these services, such as screenings for blood glucose levels and other risk factors. Tertiary prevention. For individuals already diagnosed with diabetes, the focus shifts to managing the condition and preventing complications. This includes access to medication, regular monitoring. Diabetes education programs can empower patients to take control of their health. Expanding Medicaid, increasing funding for community health centers, and utilizing telehealth services can help overcome the barriers such as high cost, transportation issues, and a shortage of healthcare providers. Structure and coordination of healthcare system. The structure of Portsmouth's healthcare system poses challenges that significantly impact residents' ability to access and receive quality care. One major issue is the shortage of healthcare providers, which leads to long wait times for appointments, delayed diagnosis, and missed opportunities for early intervention. The system is also highly fragmented, meaning care is often uncoordinated between primary care providers. This not only increases costs, but also disrupts continuity of care. To improve the healthcare system in Portsmouth, a shift towards a value-based care model is essential. This model, prevention program, and chronic health disease management focuses on health outcomes rather than the value of service provided. Expanding the number of community health centers in underserved neighborhoods could improve access to affordable and timely care. Enhanced care coordination through electronic health records and multidisciplinary teams could improve health efficiency and patient outcomes. Future trends and strategies for improving health. If current trends persist, Portsmouth will continue to face high rates of chronic diseases. To improve health outcomes, we must focus on 4 pillars: health behavior, clinical care, social and environmental factors, and physical health. Health behavior, encouraging healthier lifestyles through community-based initiatives. Clinical care, expanding access to preventative services, routine screenings, and treatment for chronic conditions. Social and economic factors, addressing the root cause of health disparities by improving education and increasing employment opportunities. Physical environment, improving access to healthy food outlets, parks, and recreational services, while also bettering the neighborhood to make people feel safe as they are working out. In conclusion, Portsmouth faces a range of health challenges, particularly related to chronic disease. These issues are compounded by social economic disparities, but through targeted public health initiatives that focus on prevention and early detection and effective management, it will lead to a better long-term health outcomes. These are the references that I used, and I thank you guys for listening to me while I went through my presentation. I hope you guys enjoy your day.